Hi, my name is Linda Borgmeyer, and I'm the Director of Rehab at the facility where you will be going following your knee replacement surgery. The video today is meant to be an introduction to how the body heals and the nutritional components to healing the body. I do not want you to make any dietary changes based on this information without consulting with your physician, nutritionist, or dietitian. The components of a healthy diet are carbohydrates, proteins, and fats. This current standard for the caloric intake is 30 to 35 kcals per kilogram of body weight. A review that was written in 2010 by Wild and colleagues states that the body will require more energy to recover, and they recommend increasing the caloric intake to 35 to 40 kcals per kilogram. And again, make no changes to your dietary plan right now until you consult with your physician. So let's look at how those components of a healthy diet interact with your healing. Carbohydrates, proteins, and fats directly affect healing. Harris and Fraser discuss how carbohydrates are required to provide glucose to support normal cell function. Part of that normal cell function following a surgery is the production of fibroblastic cells and movement of fibroblastic cells to help repair the body, and protein synthesis to aid in the healing of the wound. Protein plays a major role in healing because the collagen that forms the scar is made of protein, and the immune cells that are used to manage the wound, clean it, debride it, infiltrate it, bring it blood supply, are also made of protein. Harris and Fraser also stated that protein turnover and caloric intake expenditures are higher during healing. They further state that if there isn't enough dietary protein or protein available to the body will begin to break down skeletal muscle to get the protein it needs. This results in muscle wasting, which we do not want muscle wasting when you're trying to recover from a surgery. Fats contain fatty acids, which are an essential part of the cell membrane, and they provide a concentrated source of energy, which, as we know from the Harris and Fraser studies, the caloric needs are greater when you're healing. There have been many studies that have determined that a nutritional support enhances wound recovery. In 2010, Van Aanholt and colleagues evaluated the effects of additional supplementation for patients who were suffering from pressure ulcers. They particularly targeted the non-malnourished patients because they are typically not selected for nutritional supplementation. Their supplementation consisted of 28 grams of carbohydrates, 20 grams of protein, 7 grams of fat, along with vitamin C, A, E, zinc, psyllium, copper, folic acid, and arginine. And what they found is when they gave these patients the 3 supplements per day, the subjects that took the supplements actually required fewer dressings. And if you've ever had to have a dressing changed on a wound, it can be very painful. It also facilitated a decrease in the severity score of the wound, and it increased the rate of healing of that wound. So they determined that the additional supplementation actually accelerated the healing. In 2008, Legendre and colleagues found the same result. Their study was a study on wounds caused by venous insufficiency, basically an insufficient blood supply. And what they did is they took 85 patients from 4 different centers and they tested their blood. And they looked for the protein concentration in their blood to see if that impacted or could be an indicator of how the patient was going to heal. Well, it turns out that it does. So patients who were deficient in protein suffered poor healing prognosis. They had an increase in complications and an increase in inflammatory syndrome. So what's the takeaway home today? The takeaway is that eating a well-balanced diet before, during, and after your surgery are important and integral to your healing. The healing phases can take up to months. So just because the outside of it appears to have healed does not mean that everything has healed in synchrony with it. So it's important to continue to provide your body with the nutrients that it needs. Again, seek your assistance when formulating a plan that's specific to your needs and based on your blood work and your particular caloric needs. The other thing I want to mention to you is when you are in the facility, oftentimes you're given painkillers that will actually kill your appetite. So the rehab department will provide you with alternatives for pain management in the way of electrical stim, diathermy, and ultrasound to reduce the amount of opiates that you will need to take in order to be comfortable. This will help you to continue to take in the nutrients that you need in order to heal your body. Well, that's it. Looking forward to meeting you. Good luck with your surgery, and we'll see you in a month.